Hi everyone. Welcome back to this session and welcome back to the series where we were discussing about some of the important topics which are very important for your professional exam, first MBBS professional exam. We had discussed about the most frequently asked topics in different regions and different sections. What we'll do is we'll try to do something different today. We'll try to focus on one of the most commonly asked long essay from the section of abdomen and pelvis, and we'll try to dissect it out. We'll try to exactly write the way in which the answer should be written in your final exam. Could it be your internals or could it be your final exam? But this is how you should focus on presenting the answer. And we will pick one very important topic, and that is the topic of the uterus and its supports, right? Uterine supports are very important for your theory exam. Long essay can come from this or even short essay. There could be multiple MCQs which can be framed on this. But what we'll do is we'll focus on if uterus is asked as a long essay for 10 marker or 15 mark, right? How to answer this. This is what we'll focus on today, right? So let's get started. And first, let's see how the question on supports of the uterus can be framed, right? Now, the question on uterine supports can be framed in two ways. One is a direct simple question. Explain the supports of the uterus. This is a direct question, okay? But as we have seen over the last few years with the introduction of CBME, we get a lot of case-based questions, especially with respect to long essays, right? And this is how it could be framed. Don't get frightened by the length of the question. Focus on the last sentence, right? Which is basically on what the examiner is trying to ask. Okay, so let's read the question first. So we have a 56-year-old postmenopausal woman who presents to the gynecology clinic with a mass descending per vagina, a mass coming out of the vagina. There is a sensation of pelvic heaviness, urinary incontinence, right? On clinical examination, a diagnosis of uterine prolapse is made. They've already given the diagnosis. They are not asking you to diagnose, right? Let's read the question then. Based on the above case, explain, right? So look at the verb carefully. So what is the verb? The verb says explain, right? So you have to explain it in detail, right? Explain the anatomical factors that normally prevent uterine prolapse, right? So factors that prevent uterine prolapse. So you should not get confused with what the examiner is trying to ask. It is about what are the structures which normally prevent the prolapse of the uterus. That's it, right? This is what we need to explain. And how do we begin? Remember, any question which begins with explaining factors, explaining the differences, you need to begin well, right? So how do we begin this answer? First, start with a flowchart which gives us the list of structures or factors that support the uterus, right? So we can always begin with the supports of the uterus can be grouped as primary supports and secondary supports, right? Now, first we need to list what are these supports, and later on we can actually describe and explain each of these, right? So first, let's try to list, okay? What we'll do now is we'll try to list the supports of the uterus first, and then we will start explaining them, okay? So first, let's begin with the muscular supports, right? In muscular supports, what we have is we have the pelvic diaphragm, right? This is the most important support, the first support, right? So we have the pelvic diaphragm. Then we can mention about the perineal body, right? So we have the perineal body. Then the third structure we have is the urogenital diaphragm, right? So we have the urogenital diaphragm. So these are the three main muscular supports. Then what about visceral supports? Remember, in visceral supports, we need to mention about the urinary bladder, one. Then we need to talk about the vagina, and then we need to talk about the uterine axis, right? We will see what exactly uterine axis means. What do we mean by anteversion and anteflexion? Then, what are the fibromuscular supports we have? Again, list them. The first one is the transverse cervical ligament. Okay. Then we have the pubo-cervical ligament, right? Then we have the uterosacral ligament, right? And finally, we have the round ligament of uterus. Okay, so these are the four main fibromuscular or ligamentous supports. List them first. Then come to secondary supports, and in secondary supports, what we have is we have the broad ligament of the uterus first. Then we have the uterovesical fold, right? We have the uterovesical fold, and then we have the rectovaginal fold, right? So this is how we list. Now, this part is absolutely essential. This actually tells the examiner that you know the concept and you have concised it, right? So the way you begin your answer carries a long-lasting impression, the way the examiner corrects your paper, right? So this is how ideally you should begin. First, classify the supports, right? And then start explaining each support, right? Now, since this is a 10 marker, the examiner expects you to write few things about each of the supports, right? You have to explain each of the factors. Now, how much to explain is what we will discuss now, right? So first, let's start with the muscular support, and out of which the first thing we have is the pelvic diaphragm. Now, always begin your answer with what is pelvic diaphragm, right? Pelvic diaphragm is basically a muscular partition. Where is it located? Remember, it is located between the true pelvis and the perineum. We know that all the structures that lie below the pelvic diaphragm constitutes the perineum, right? So this is the muscular partition between the true pelvis and the perineum, the first sentence. Then, how exactly it is formed? We know that pelvic diaphragm is formed by two muscles. Name the two muscles first. What are they? One is the levator ani and the other one is the coccygeus. Now, under levator ani, write the three components. What are the three components of levator ani? Levator ani has three parts. These are the sphincter vaginae first, then we have puborectalis, and then we have the ileococcygeus, right? So this should be the second line, right? Once you have written this, now it's time to draw the diagram, right? So what we'll do is we'll try to draw the outline of the pelvic diaphragm and how does it support, right? So begin with the pubic symphysis anteriorly, right? So let's imagine this is the pubic symphysis. Then we have the istiopubic rami on both the sides, and then we have the ischial tuberosity, right? So let's imagine this is the ischial tuberosity. Posteriorly, draw the outline of the sacrum and the coccyx. Now, first write the three openings which are present in the female perineum. So anteriorly, what do we have? We have the urethra. Behind us, we have the vagina, right? Then we have the rectum and the anal canal, right? Now, in between these, what do we have? We have the perineal body and we have the anococcygeal raphe, right? With this, we have the outline of the perineum. Now start drawing the outline of the levator ani and the coccygeus muscle. The coccygeus muscle, first write it as extending from the ischial spine till the sacrum, right? So this is the fiber of the coccygeus, right? Also called as istiococcygeus. Now, we need to draw the outline of levator ani. So levator ani first, let's say will have what? The sphincter vagina. So first draw the outline of the sphincter vaginae surrounding what? Surrounding the vagina, right? That is sphincter vaginae. Then what do we have? We have the puborectalis and then we have the ileococcygeus, right? So next write the fibers of the puborectalis, right? Fine. So these are the fibers of the puborectalis. And finally, what do we have? We have the ileococcygeus, right? Which is attached to the anococcygeal raphe as well as the coccyx. So this simple diagram actually tells us about the entire outline of pelvic diaphragm. So this is the first diagram that needs to be written for this question. Okay, diagrams are as important as your description, right? So once you write this below the formation, you need not worry about the attachments. Don't try and describe the attachments here. Okay, then the last line is a must. Okay, how does each structure support the uterus from prolapse? Now, pelvic diaphragm is actually forming the floor of the true pelvis, right? So it supports the uterus from below. That is what you need to write. So the pelvic diaphragm will support the uterus from below, right? Write this highlighted. Okay, maybe write it in bold letters, or write it in inverted comma, or just underline it. But do it so that the examiner sees it. How each support prevents the prolapse is very important. Fine. And this is what you're expected to write. Are we clear? So this is how you describe the pelvic diaphragm. And once you have written this, move on to the next, that is perineal body. Now again, start with what exactly is perineal body. It is a fibromuscular node. Definition. Where is it located? It is located at the junction of, it is simple, urogenital triangle and anal triangle. Right? This is how you write it. Or otherwise, you can write one more way. It is located in between the vagina and the anal opening. This also is correct, right? But write what it is. A fibromuscular node and where is it located. Done? Then, how exactly it is formed? We know that the perineal body is formed by the convergence of 10 muscles. Now, your job is to highlight this. So, perineal body is made up of 10 muscles and now list 10 muscles. Remember, perineal body in itself could be an important 3-marker question for you, right? So, write about it, then list the 10 muscles. What are the 10 muscles? We have 2 superficial transversus perineum, we have 2 deep transversus perineum, we have 2 bulbospongiosus, and then we have the 2 levator ani from both the sides, and then 1 sphincter ani externus and 1 longitudinal muscle of the anal canal. First, write this perineal body what it is, then list the muscles, and then again write how does perineal body will support the uterus. Now, if you ask me, is it necessary to draw the diagram of the perineal body? I would say no. But we need to show a diagram in which we can show how a torn perineal body can result in prolapse. We will do it. Okay. So how does it support the uterus? Remember, it supports the uterus again from below. So what is the diagram that we can write for this? Okay. What you do is you write the sagittal section of the pelvis, the coronal section of the pelvis, I'm sorry, right? This is the coronal section of the pelvis. And let's imagine this is the pelvic diaphragm, right? And in the center, we have the perineal body. Above this, show the outline of the uterus. So let's say this is the outline of the uterus, right? The perineal body is supporting it. Now, show one more diagram, right? Again, so let's take this as the lateral pelvic wall. Now, this as the same pelvic diaphragm muscles, but now your perineal body is torn. So what happens? Your uterus sort of prolapses through this gap of the torn perineal body. Now this diagram is enough. Okay. Again, I'll repeat as we did in our previous classes. Examiners will not look for artistic diagrams. A simple diagram which explains the structure or the concept, that is enough. Okay. So put a simple line diagram for perineal body to show how torn perineal body can result in prolapse of the uterus. right? Done. So this is regarding perineal body. This is how much you are supposed to write. Then the third important muscular support is the urogenital diaphragm. Again, remember, urogenital diaphragm is a partition present in the urogenital triangle. Okay, you can start with this. But what is more important? How is it formed? It is formed of two muscles. Now, what are they? Remember, one is the sphincter urethrae, right? One is sphincter urethrae, and the other one is the deep transversus perineum, right? These two muscles are covered by two fascia. Okay, so what are the fascia? These are the superior fascia and inferior fascia of urogenital diaphragm. This is all that is required. Okay, urogenital diaphragm you can add is a muscular partition, right? Muscular partition located within the deep perineal pouch. So this could be the first line. Then second, how is it formed? Third, again, how does it support? So remember, it supports the uterus from below. I say that this is possibly the most important line in your answer. How each structure supports the uterus, you have to quote. Done. So this is how you write about the muscular support, and that is the urogenital diaphragm. Are we clear? Done. Then once we are done with the muscular supports, go to the visceral supports, right? In visceral supports, of course, there are two important visceral supports, urinary bladder and vagina. Urinary bladder will support the uterus from below again, right? Now, vagina will support the uterus. Now, with respect to urinary bladder, does it support it from below? How? Remember, the urinary bladder superior surface on which the uterus rests, right? So, let's say below and anteriorly. We will see how. For vagina, it supports the uterus from below. Now, how to explain this or show it in diagram, right? So what we need to do is draw a simple outline of the pubic symphysis, draw a simple outline of the sacrum and the coccyx, right? Now, show the urinary bladder first. So let's imagine this is the urinary bladder and the urethra, right? Now, the uterus, right? So let's show the uterus. The uterus actually rests on the superior surface of the urinary bladder, right? Extending from this, let's say we have the anterior vaginal wall and the posterior vaginal wall, right? Then posteriorly, what do we have? Posteriorly, we have the outline of the rectum and the anal canal, right? This is what we need to show for how is it supported by urinary bladder and vagina, right? The vagina itself is constricted by the levator ani muscle, the sphincter vaginae part, right? So this simple diagram is enough to explain urinary bladder and vaginal supports. But how, from which direction you need to write? But in the visceral support, the most important topic, subtopic you need to mention is the uterine axis. You should never forget this. Anteversion, anteflexion. You need to define what is it and then probably write a diagram. We'll write a diagram, right? So what is anteversion? Anteversion is the angle between the cervix and the vagina, and normally it is about 90 degrees. That's it. Anteflexion, remember, it is the angle between the cervix again and the body of uterus, right? And normally it is about 170 degree. Most of the textbooks also describe it to be 120 degrees. But for both of them, you need to show the diagram, right? Or one simple diagram in which you can show this. So what we do again is we draw the outline of, let's say, the uterus, right? So let's imagine this is the outline of the uterus. And let's imagine this is the cervix and this is the sloping anterior and posterior vaginal wall. Now, how do we show anteversion and anteflexion? So anteversion, what is it? It is the angle between what? The long axis of the cervix and let's say the long axis of the vagina, right? And normally this is 90 degrees. How do we show the anteflexion? Remember, the anteflexion is the angle between the long axis of the body of the uterus and then the long axis of the cervix. So this is about 170 degree, right? This one single diagram is enough to show anteversion and anteflexion. But so this is one diagram. This is one diagram you have to write. So how many diagrams did we do till now? The first diagram for levator, ana, and a pelvic diaphragm. The second diagram to show the function of perineal body. The third diagram is to show the relation of urinary bladder and the vagina. And then the fourth diagram to show anteversion and anteflexion. Simple diagrams, do it quickly, right? Then the next important support we need to show is the fibromuscular support, right? In fibromuscular support, the first one is the transverse cervical ligament. Start with what are the other names given for this ligament. So for example, this is also called as the cardinal ligament of the uterus, right? Apart from this, we also call it as what? We also call it as the McEnroth's ligament, right? So we call it as cardinal ligament of the uterus or McEnroth's ligament. Now, what is the attachment of each of these ligaments? You must mention, okay, in what single sentence? For example, transverse cervical ligament. Remember, it extends from the lateral aspect of the cervix, right? The lateral aspect of the cervix to the lateral pelvic wall. That's all. This is all that is required. If you want, you can add one more line saying that it's a condensation of endopelvic fascia. But from where to where it extends must be written clearly. The second line, what or how does it support? Remember, it supports the uterus from the lateral and inferior aspect like a hammock. Now, this word is what the examiner will look for, right? Transverse cervical ligament support the uterus like a hammock, as you see in the beaches, right? So this hammock word is the keyword here and you have to mention. Then the other keywords, cardinal ligament, McEnroth's ligament. Now how to show this in diagram? Let's try to draw again a simple line diagram for this, okay? So again, start with the simple, right? So what we'll do is anteriorly we'll show the pubic symphysis, right? And then the istiopubic ramus. Posteriorly will show what? The sacrum and the coccyx, right? And then here what do we have? The opening of, let's say, the urethra, the vagina, and then the anal canal, right? So what is important for us here is the uterus. So how do we show the ligamentous attachments? The transverse cervical ligament. So let's close this outline. The transverse cervical ligament extends from the lateral aspect of the cervix to the lateral pelvic wall. One single diagram, right? Then from the cervix to the coccyx and the sacrum, we have the uterosacral ligament. This is uterosacral. This is transverse cervical. Then anteriorly, we have something called as pubocervical. Done. This simple diagram is enough to show the attachment of the ligaments. Done, right? Apart from this, we also need to write one more diagram to show at least one important ligament which cannot be shown in this transverse section. And for that, again, draw the outline of the pubic symphysis. Let's say this is the outline of the urinary bladder, then the outline of the uterus and the vagina, and posteriorly the rectum and the sacrum and the coccyx, right? So in this, which ligament to show? All we need to show in this ligament is the round ligament of the uterus, okay, which gets attached to the labia, right? Here itself, we can show one more, pubocervical, okay? Then we can also show uterosacral ligament, right? It hardly takes time, right? You need to label it, of course, but this is how you do it, right? These two diagrams are must, because of all the supports apart from the pelvic diaphragm, the ligamentous supports are the ones which actually prevent the prolapse of the uterus. Fine. So this you must write. Are we clear? So this is how you should explain it. Right. So transverse cervical ligament, also called as the cardinal ligament or McEnroe's ligament, extends from the lateral aspect of the cervix to the lateral pelvic wall, support the uterus from the lateral and inferior aspect like a hammock. Done. This is how you write it. Okay. Then the pubocervical ligament extends from, again, the cervix to the posterior surface of pubis. Posterior surface of the pubis. One single line about its attachment. Then it supports the uterus from front. Right? Hi Tenu. Hi Lohit. So this is how you should describe the pubocervical ligament. Okay. From where to where does it extend and how does it prevent the prolapse of the uterus? Are we clear? Right. Then the other two ligaments, let's try to learn. So remember, we have discussed that these two diagrams are absolutely essential. So let's say these are the fifth and the sixth diagrams, right? But these are absolutely essential. You have to write it. Okay. Then the next important ligamentous support is the uterosacral ligament. Now we have seen it extends from, again, the cervix to the S2 and S3 segment of sacrum. Right? So this is the extent. Then it maintains. Now, how does the uterosacral ligament and round ligament actually prevent the prolapse of the uterus? The uterosacral ligament maintains anteversion, right? It maintains anteversion and it maintains anti-flexion, right? They exert a pull on the cervix, right? Thereby maintaining anteversion and anti-flexion. So similar to that, the round ligament of the uterus, which extends from the cervix to the labia majora, right? The round ligament of the uterus actually traverses through the entire inguinal canal before it attaches to the labia majora. But again, the uterosacral ligament and the round ligament have the same action on the uterus, right? How? So remember, these also prevent the anteversion and anti-flexion, right? These also prevent anteversion and anti-flexion. This is how you need to write it, right? So this is how you explain the primary supports. Done. Start with the muscles, then the visceral supports, and then the fibromuscular supports. Done. Right. Then the next important thing is regarding the secondary supports, right? The secondary supports are nothing but the peritoneal folds, right? So peritoneal folds do not truly support the uterus like our primary supports. That's why we call it as secondary supports. And out of this, we need to talk about the broad ligament, the utrovesical fold, and the rectovaginal fold. Now, is it absolutely necessary to draw a diagram of the broad ligament? Not needed. But we can actually show the utrovesical and the rectovaginal fold. We'll see how to draw it. Okay. So what is broad ligament? Broad ligament is a broad peritoneal fold, right? That's the first thing. It's a peritoneal fold. Done. It extends from where to where? It extends from the lateral margin of the uterus, right? It extends from the lateral margin of the uterus to the lateral pelvic wall, right? How does it support? It supports the uterus from the lateral aspects, right? From the sides, it provides support to the uterus and prevents it from prolapsing through the vagina. Then the utrovesical fold and rectovaginal fold. So this is the fold between what? The uterus and urinary bladder, right? So when the fold reflects over the anterior surface of the uterus, it prevents the prolapse of the uterus, but this is acting from above, right? Rectovaginal fold is the fold between the vagina and the rectum. Now, how to show these? Again, it's very simple. Again, draw the outline of the pubic symphysis, right? Then draw the outline of the sacrum and the coccyx behind, right? Then show the urinary bladder in front with the urethra, join with the labia. Then show the anterior surface of the uterus resting on the urinary bladder, and let's say this is the vagina, and posteriorly of course we have the rectum and the anal canal. Now we need to show the peritoneal folds. How do we do it? So just show extension of the anterior abdominal wall. The peritoneum of the greater sac lines the superior surface of the urinary bladder, reflects over the anterior surface of the uterus, then gets reflected over the rectum, forming two folds, right? So here we have the rectovaginal fold. Here we have what fold? The uterovesical fold. This simple diagram is enough to show these two folds. But remember, both of these will prevent the prolapse of the uterus by supporting it from above. Right? So in simple, the simple template you need to follow is first define what the support is, then mention about its location, then possibly little bit about its attachment, and finally how it prevents the prolapse of uterus. So for each of the support, if you are able to describe it under these headings, right? Nothing like it. Are we clear? So this is how we should be writing the answer for the uterine supports. Are we clear? And you need to do this within, let's say, 25 to 30 minutes. Okay. And it is quite possible. Never attempt a long essay beyond 25 to 30 minutes because you will lose time in answering other short essays. Done? So this is regarding how to describe the supports of the uterus if it is asked as a 10 marker question. Right? If you have any doubt with respect to this, let's try to discuss it. If you want me to discuss any other topic like this for your final exam, please type it in the chat box so that we will take up these topics for our next upcoming sessions. Right. Fine. So we will come up with one more topic for our next session. So keep watching and subscribe to the channel and explore how to answer questions for your theory exams. Thank you all of you for attending this session. All the best for your upcoming internals or the university exam. We'll continue this session next time with one more important topic for your final exam. Thank you.
Thank you, sir. Sir, you can log out.
Okay, okay, sir. Yeah, thank you.
Okay, I'll speak to Rohit.